Good day. I am Dr. Agatha Garcia, and I will give an introduction on the impact of COVID-19 on child nutrition. The objectives of this introduction are to cite the state of child nutrition even before the COVID-19 pandemic, to identify the changes in society brought about by the COVID-19 pandemic, and to discuss the impacts of COVID-19 on child nutrition. In 2015, the United Nations member states have adopted the 2030 Agenda for Sustainable Development. SDG 2 seeks to end hunger, achieve food security, and improve nutrition, such that by the year 2030, no one will go hungry anywhere in the world. But as you may see, even before the pandemic, the world is not on track to achieve zero hunger. As of 2020, notwithstanding the effects of COVID-19, there are 45.4 million wasted, 149.2 million stunted, and 38.9 million overweight children. Then, the COVID-19 virus attacked the whole world. The pandemic has started undermining nutrition among the vulnerable, with the worst consequences being borne by young children. In order to mitigate the spread of the disease, various degrees of lockdowns and physical distancing were employed to control human movement. In March to June 2020, this has led to a 30% reduction in the coverage of essential nutrition services in low to middle income countries, and declines of 75 to 100% under lockdown contexts. Here is the World Health Organization summary of the impacts of COVID-19 on child nutrition. Number one is wasting. It is estimated that an additional 6 to 7 million children under 5 may have wasting in 2020. Number two is the effect on equity. COVID-19 is increasing the global poverty, thus further deteriorating the nutritional status of the poorest people. Poorer children will have more nutrient-poorer diets. Stunting among them will be 2.4 times higher. Number three is the interference in health services, like the vitamin A supplementation, which may lead to 160 million children under 5 missing a crucial dose. Number four is the effect on hunger. 44 million children have gone hungry in 2020, and 370 million children have missed nutritional school meals. Number five is food insecurity, which is being reported by many countries, with the rate doubling in 2020. And lastly, COVID-19 is disrupting women's access to nutritional services, antenatal care, and education. This has an impact on intergenerational nutrition, since a malnourished pregnant woman may give birth to a small infant. Et al. Has projected the 3-year impact of the COVID-19 on maternal and child nutrition. In the moderate case scenario, by 2022, COVID-19 could result in an additional 9.3 million wasted and 2.6 million stunted children, 168,000 additional child deaths, 2.1 million maternal anemia cases, and 2.1 million children born to malnourished women. Estimated increase in child wasting is only the tip of the iceberg. The COVID-19 pandemic has also increased other forms of child malnutrition, namely stunting, micronutrient deficiencies, and overweight. Do these have a long-term impact, which can persist into adulthood? Children suffering from wasting due to poor nutritional services during the pandemic have weakened immunity, making them more susceptible to COVID-19. They are susceptible to long-term developmental delays and face an increased risk of death, particularly when wasting is severe. Difficult access to nutrient-rich food during the pandemic led to the intake of cheaper and more available processed foods, which together with inadequate levels of physical activity may increase the child's risk of obesity and diet-related non-communicable diseases in later life. The full impact of the pandemic on stunting possibly takes years to manifest. Children suffering from stunting may never attain their full possible height, and their brains may never develop to their full cognitive potential. These children begin their lives at a marked disadvantage. They face learning difficulties in school, earn less as adults, and miss opportunities in later life. Thus, a stunted female adolescent will become a small pregnant woman who is more prone to chronic diseases and complications during pregnancy and will most likely give birth to a low birth weight or a preterm baby. Which brings us back to the cycle of intergenerational growth failure and malnutrition that is propagated to the next generations. These consequences are not only devastating for families, but they also impact national economies and social development as human capital and capacity are depleted in the years to come. The pandemic is projected to affect the economy by giving rise to future productivity losses. In the moderate case scenario, the estimated burden due to additional childhood stunting and child mortality during the pandemic would be a loss of $29.7 billion. Additional cases of anemia during the pregnancy would result in $79 million in lost productivity between 2020 to 2022. Without adequate action, the profound impact of the COVID-19 pandemic on early life nutrition could have intergenerational consequences for child growth and development, as well as lifelong impacts on education, chronic disease risks, and overall human capital formation and economies. That is why we need to act now. Thus, in July 2020, UNICEF, with the Food and Agriculture Organization, the World Food Programme, and the World Health Organization, issued a call to action in the Lancet, warning of the pandemic's potential to worsen the pre-existing crisis of malnutrition. Their 5-action program aims to address children's right to proper nutrition during the pandemic to stop further deterioration of malnutrition. How was this translated in the Philippine setting? I now turn you over to our next speaker. Thank you for listening.